Thank you all for joining us today, the City of Middletown and Atrium Medical Center. Uh, Happy to have everybody on board today. We have Mayor Nicole Condrey and Dr. Keith Bricking from Atrium Medical Center, and our Health Commissioner of the City of Middletown, Jackie Phillips. And I am your moderator, Shelby Quinlivan from the City of Middletown Communications. So we wanted to put these people in a room, so to say, in order to talk about the ongoing battle of COVID pandemic and the difficulties that are going on throughout our community in the different areas that are impacted. So I wanted to start off with all three of you answering what the biggest hurdle or difficulty is for you as your job description. So Jackie?
Great. Hello, everyone. And wow, just being the health commissioner for the city of Middletown, I am struggling with that ambivalent feeling of everyone just stay home and be safe. And then I want to say, but then if you go out, here's a way to stay safer. And so I would really want all of our community and across our state and our country to be as safe as possible now and during the holiday seasons with COVID being on the rise. But I realize that often it's important that we know what we're dealing with and how to be safe. So that is my number one concern.
Dr. Bricking?
Good afternoon. Thank you for allowing me to join you today. Similar to Jackie, I think that our biggest priority still is safety of the community, safety of our staff, safety of our patients, and certainly safety of the visitors coming into the hospital. Another thing that weighs heavy on my mind is staffing. So as the COVID volume increases, there certainly will be an impact to the number of patients hospitalized with COVID, and certainly concerned about whether we're going to have enough people in the community that will be able to take care of these patients in the hospital.
Mayor?
I'm going to take it a little bit more personal level. The biggest challenge that I've had when it comes to my job is I typically meet with people in our local coffee shops. So Java Johnny's, Straight Shot Coffee, Triple Moon, that's my office basically. City Council doesn't have an office in the city building. So I've been without an office and unable to meet people in person, which is how I like to meet them. There's so much we lose in that personal communication. So Zoom is great and I'm grateful for these opportunities, but we are definitely missing that human aspect. And I know people are feeling that in a lot of different ways.
That's for sure. Jackie, do you want to cover the status of our community right now and our caseload at this point?
Yes, right now, and our numbers are increasing by the moment, but I looked at our cases as of yesterday. They're coming in and we're getting them prepared to start investigating. We have almost 1,500 cases. I have been telling people that I remember October 1st or 2nd, I think it was a Friday, we were around 610 cases. So in the last 6 weeks, we have experienced a lot of growth in numbers. And so right now we are experiencing, some people will say exponential or an explosion of cases. And I know that Dr. Bricky can tell us more about those cases, but we're seeing a lot more people sick. And we're seeing hospitalizations. And again, we're starting to see some of the lagging vulnerable populations as far as deaths right now.
So Dr. Bricking, how does this surge impact the hospital and the staffing related to that?
Well, what we're seeing, because of the peak in the community, you typically would get an impact or a trend also in the hospital, where the number of people hospitalized goes up, the number of people in the ICU goes up, And unfortunately, the number of patients on a ventilator and then potentially dying from COVID goes up. We are currently about 2.5 times the volume across the region to our previous peak of hospitalized patients several months ago. And now that we're having across the state 7,000 patients a day testing positive, we know that there will be a certain impact to the hospital over the next couple weeks. We continue to see a range of age of patients. Initially we certainly understand that the more frail and potentially the more senior elderly patients were being hospitalized, but we're seeing individuals in their 30s all the way into their 80s and 90s that are hospitalized. We are seeing patients that are on a ventilator, again in the 30s all the way into their 80s and 90s. Certainly patients that have risk factors with comorbidities of hypertension and diabetes and stroke, those patients are being impacted, but other healthy individuals are also being impacted. Anytime you have an increased volume of sick patients, COVID patients, you're obviously going to impact the number of beds that you are using for these folks. And so what we're finding is our percentage of COVID positive patients in the hospital continues to trend up. And that's not unique to Atrium. That is consistent across all of Southwest Ohio and the entire state. So as we continue to care for our other typical patients that we're managing, the traumas, the stroke patients, the chest pains, the mild and moderate injuries, we're trying to manage those patients on top of the COVID patients. And so with that, we are starting to see stresses in the system when it comes to staffing. All of the hospitals in the area are in the same situation where we are fearful that we may not have enough nurses, enough techs, enough physicians. Right now, we're managing pretty well. Our staff has been incredibly resilient, and they continue to manage this pandemic to the best of their ability. But our caregivers are tired, and potentially we're at the beginning of the worst phase of this. This could be going on where we get this peak of numbers over the next several months. And so difficult decisions are going to have to be made on how we're going to continue to manage these volumes as they come to the hospital.
Dr. Bricking, I just wanted to say thank you so much, from the citizens of Middletown for all that the healthcare workers are doing at Atrium and other locations. We're really grateful, and please, I hope you would know that the whole community would love to support those healthcare workers in any way. So if there's things that you specifically know we can do for them, we would love to do that and organize anything.
Well, we certainly appreciate that, and we have seen a lot of community outreach over the last several months, especially when it comes to making masks and donations, raising dollars for testing kits, and I suspect that those needs will continue. So we'll make sure that we communicate those with you and with Jackie. We're here to serve the community. We enjoy doing that, and we just want as many citizens of Middletown to know as possible that continuing to be patient and mask and socially distance is going to be critical, not just to keep them safe, but also to keep our healthcare providers that want to take care of them safe. Thank you.
So along those lines, I know we're in month 8 of this now, 8 or 9, I'm losing track. Mayor, what kind of care can people be doing as far as mental health, physical health, to take care of themselves and each other during this time?
Yeah, I mean, it's important that we realize that this crisis is not just one of COVID. It affects us in every way, and mental health is, one could argue, worse than the COVID itself in many ways, and it hits our economic aspects, our pocketbooks, our business owners. So we have to stay strong, and that's why I mentioned to Dr. Bricking, whatever we can do to help our healthcare workers. That's one way that we can stay mentally strong, by giving to others and supporting others. It actually helps us in turn. So that's something people can definitely continue to do is help others, because it does help ourselves as well.
Right.
And one other thing we can do is continue to wear those masks in public. I know just recently, just to go over the most recent orders that came out, I know it's hard to keep on top of all of them. And I do understand another one just came out about a curfew, so we can get into that and exactly what that entails. But first of all, coronavirus.ohio.gov is going to be the best resource for everybody. It has been for many, many months now, and they continue to keep that really well updated. The most recent ones that I saw come out, and Jackie or Keith, you can correct me if I'm wrong here, but I saw yesterday an Ohio Department of Health order became effective about the wearing of masks in businesses, which is now required by patrons, except for children under the age of 10, and that businesses also have to clearly post at all entrances that people are required to wear a mask. This is a document you can download from their website and print out and just put it on the front of any door, and that will suffice for that requirement. And they also said businesses should designate an on-site compliance officer, which will help keep us accountable and make sure somebody's there, making sure we're staying on track there. The other part is keeping those groups to 10 or fewer. There is an actual Department of Health order from Ohio that came into effect today about the groups of 10. I don't know, Jack, if you have specifics more than that, but I know like wedding ceremonies and funerals are exempt, but basically outside of a private residence, any group of 10 or more is prohibited by Ohio Department of Health. And if you have violations to report, there is a phone number for that. It's 833-4-ASK-ODH. And there's option 1 you can press to do that. But they also have a mental health line. So this is, to me, even more critical, right? There's a mental health line that's open 24/7. That's the Ohio Care Line, and it's 1-800-720-9616.
Excellent. That's excellent. And can I just add to that a couple of things? That is a great website. If you go to the City of Middletown's website, Shelby and Nancy here do wonderful jobs at putting information as far as local resources, but we also automatically will circle you back up to the state's resources. So you're absolutely correct. But I just want to say a couple of things with those comments. We're connected together. Everything is intricately connected together. So you can have great mental health without having great physical health, and great physical health without great spiritual health. It all goes together. And we can't really separate it, right? And then when we get lonely and blue, and that's when we tend to get really sad and depressed, we need each other. We need that human connectivity. And so with the pandemic, we're recognizing all of the above, and we just got to find a way to do that safer or safely and safer. And so large groups of people gives you more of an opportunity to spread the virus. That's why we say keep it small. We say keep it to your own private bubble, because you've been around pretty much the same people, and it gives you another layer of protection. But I want to remind people that when you have people coming in and out of your bubble, my husband goes to work during the day and I come to work during the day, and we come back home. Sometimes mask wearing at home may be something very important. If one person in your household has had a high risk activity or been in a high risk, I bet healthcare workers, they're in high risk places and situations all the time, that sometimes it may even be a good place to wear your mask at home as well. And so don't think masks are just for strangers. Sometimes here we get it confused. We think, oh, when I get with my staff, I can be safe and take my mask off. But often it's your close contacts, your family or your staff that may be the culprit, right? Because you let your guards down. So just be safe, and just remember that it's really important to try to keep that distance, wear a mask, wash your hands at all times possible. And that's the way to stay safe. And last but not least, as far as this conversation, the City of Middletown, when you said, what can we do for healthcare workers? The best thing you can do right now is to stay safe. The best thing you can do right now is to stay healthy. The best thing you can do right now is to wear your mask and keep up that good hygienic position, or I call people that behavior, right? Because then we'll be less likely to have to be taken care of by our loving healthcare workers. So if they say, what can I do for you? I think all of them would say, stay safe, stay back, mask up.
So, Dr. Bricking, speaking of staying safe, there's, I'm sure, some people who are nervous if they have some other kind of medical issue, thinking that they should not go to the hospital because of the risk. What would you say to those people?
You know, I often say, and I truly believe, one of the safest places for anyone in the community is going to be in a healthcare setting. We are incredibly diligent about making sure that the space is as clean as possible. We have typical routines where we go through our waiting rooms, where we go through the patient rooms, and make sure that we're making sure that the environment is safe. We are screening all of our patients that come into the hospital. We are testing every admission. We are screening all of our visitors. We are screening all of our employees for symptoms. Anybody that's coming in for a surgery is getting tested for COVID prior to their surgery. I really feel like there is a safe space within the confines of a hospital or a physician's office, without a doubt. And what we don't want to do is delay care. You know, what we've seen already from some of the things that we from back in March and April and in May, when people were avoiding the hospital, avoiding seeing their physician, are delayed diagnoses. And the last thing that we want to see are people that are staying home when they're having stroke symptoms, staying home when they're having heart attack symptoms, delaying urgent or emergent care. So it is a safe space, certainly, to take care of patients. What we want to do is we want to make sure that we have enough people to care for those people needing the other care, the trauma care, the cardiac care, the stroke care. And by doing that, we have to get the COVID volume down. We will certainly continue to manage everyone that walks in the door here, and we know that we're going to keep them as safe as possible. I do want to follow up on one thing that Jackie said, and I think she hit it right on. It is critical that we don't let our guard down. And our guard down could be while we're in our break room at work. Our guard could be when you're in the car driving with a coworker or a friend. Those are times where if they're not in your personal bubble, your home life bubble potentially, or you don't know who they've been around, it's always better to mask up. And the other important thing is hand hygiene. Make sure that you're using hand sanitizer, you're washing your hands as frequently as possible. It is just as important, if not more important, than the masks.
Yes.
Okay, so Mayor, I know that the small businesses in Middletown and around the country, around the world really, have had a huge impact, detriment really to their businesses. And I know the city has done a lot, as have some of the counties. Do you want to touch on some of the things that we have going on right now that businesses can touch on as far as grants are concerned?
Yeah, I'm so glad you said that. So I was just going to bring up the CARES Act financing for small businesses it's currently posted. Shelby, you've been doing a great job posting that out on a lot of different forums. So small businesses, 25 employees or fewer, there's CARES Act financing available for you to apply to. The big lesson here that we all need to take is engage the City of Middletown's Economic Development Department, because if you engage them, give them a call, even the Small Business Development Center, but we really recommend going to the Economic Development Department itself first, and they can help parse out for you where to go. They know that big picture of all the different resources that are available and which ones will specifically help the business that you are trying to keep thriving during all of this. So at a minimum, check out these CARES Act financing dollars that are out there right now. There's applications and links pretty much everywhere, right, Shelby?
Yes. Yeah, I think between the city, Warren County and Butler County CARES Act funding, we are almost at $500,000 worth of grant programming that we can distribute out, and we have to distribute out by the end of the year. So this is really a critical time. If you are in need, you are a small business that needs a little help through these times, we have the help available for you, and you just need to apply.
Right. And the great thing about these programs is if there's another community who perhaps doesn't use all of the dollars, guess what? Those dollars go back into the bucket for communities like hopefully ours who have more businesses engaged and looking to use the money. So it will get redistributed if other communities don't use it. So get out there. The more businesses, the better we can get to apply for this so we can keep thriving as a city together.
Absolutely. So I know upcoming, and I know the governor just made a new ruling on the curfew, which we can touch on with this transition, but Thanksgiving and Christmas and Hanukkah coming up, all, family group activities. There's a lot that's been canceled and changed, adjusted, Zoomed, virtual, everything. Jackie, what should people really pay attention to during these holiday times?
Thanks, Shelby. If we all think about this virus is airborne and it likes to go person to person, or I tell people breath to breath, because that's why we say we're to put a mask on, and that's why we say keep your distance so that you can keep your breath to yourself and people can keep their breath to themselves. And if anything were to escape those areas, they should fall short, right? If we're 6 feet or more. So I do believe, just like back in March, when we were doing all of after the shutdown, we can pretty much do everything we used to do, but we just have to do them differently. So Thanksgiving, I personally, I try to lead by example. I always tell the mayor, I said, I want to do this, but I like to lead by example. So I plan on staying at home alone with my husband. He may go out, but I'm going to be at home. However, if I decided to host a dinner, it would be 6 or less. It would be someone that's in my bubble or usually in my bubble. And we would try our best to eat quietly. Again, going back to what our mom said, don't talk with your mouth full. And then once we're finished eating, separate utensils, not sharing things. This is a time to do those paper products and paper plates, so you're not sharing things. Then after we finish, we can go to a larger area, put our mask on, and socialize and talk. But eating and drinking and praying and holding hands around a large table with family just really is not the safest thing to do at this time, unless those people have been in your bubble. So every time you hear all of those rules and regulation, if you go back to say, I want to have this kind of activity, how can you make it safe? How can you do it with a mask on? How can you do it socially distancing outside if we're blessed with nice weather, heating tents or whatever? Or you may even take higher risk people that have been sequestered, if you will, like grandma, grandpa, or whatever. They may sit at a table safer than college kids or the younger people that may be in the household that's been around people. And so you have to look at everything that you do safer. And if you're blessed to have Thursday, Friday, Saturday, Sunday, have multiple small gatherings that do not include eating and drinking when you can't wear a mask, because it is all about family and loved ones and checking on people. This is a good time, just like our mayor said, to check up on our neighbors, our loved ones, our older people in our congregations. But we don't have to go over with a lot of people. We can go over one-on-one, a mask on, give them a card and a basket, tell them that you love them, and leave. So you've been there with a mask on, you kept your distance, and it's only a short period of time, but you still reached out and connected with them and showed them love. So everything that we do, we should be able to do it safer. If at all possible, that whole a curfew is all about trying to keep people from being around a lot of other people and congregating, trying to keep people back home safely in their bubble. So every time you hear any rule or regulation, it's not to spoil your party, it's to keep you safer back with your close bubble so that you cannot or have a lower risk of spreading the virus. So just think about that. Driving safer in a car with your bubble than a plane ride, because that's airport and the actual plane. So every chance you get, just try to, at all possible, if it's a no, you can't stay at home like I'm going to do, then it would be, how can I make this activity as safe as possible if not for me, but for all my other loved ones. Last but not least, my husband's mom and dad are 92 and 93. I have to say this. They may feel like I'd rather see my loved ones, my grandkids, great grandkids, one last time. But their kids are very high risk. My husband, 65, his brothers and sisters, 70, 73, heart problems, open heart surgery. So we have to protect every part of our family, even if they think I'll take my chances. We have to be the ones that say, no, we want it safe for everyone.
Want to keep grandma and grandpa safe.
Yes.
Dr. Bricking, I wonder if you can answer this question for me. A lot of people have one mask and wear it all the time. And I have mine right here, and my mother made this for me. But to those people, do you have to wash your mask, or can you wear it consistently every single day when you're out?
Certainly the recommendation at this point is that if you have a washable mask, it should really be washed at least once daily. And if you're using a disposable mask, you do not reuse that beyond that day. We still are seeing a fairly high percentage, maybe 30+% of people that are testing positive with COVID have no symptoms. When you have no symptoms and you have your mask and you're breathing on your mask, where potentially do the virus or the germs go? They go on your mask. And then you grab the mask the wrong way, you reuse it, you're not careful with it, then you potentially could be spreading the virus. So certainly from a hygiene standpoint, recommendation, throw away the disposables after one day of use when you're out in public, and re-wash the washables at least daily.
I do want to mention that if any residents do not have masks available to them, our Middletown Fire Department headquarters has free masks available in their lobby. So you just have to go pick one up. I know they have a box right there. And I know there's other areas in the city that have free masks as well. But yes, disposables, one use only. Want to make sure that everybody knows that. So, Mayor, do you want to talk about the curfew that has just been initiated?
Can I throw one more thing in about holidays?
Absolutely.
Real quick. So it just dawned on me that our military community is probably a lot more in tune with this remote holidaying than maybe civilian world. Because I was thinking that, gosh, I've done this quite a lot. And my brother and I came up with this cool idea. It's maybe not that unique. I thought it was unique at the time, but we found a recipe that we both decided we were going to make, and I made it, 13 hours ahead. But we were on the same, so we faced at the time, I guess it was FaceTime or something like that, but we would make it, and for him it was maybe breakfast time, and for me it was dinner, but whatever. We were making the same recipe at the same time. Of course, the ingredients I could find were not quite the same, but we would make the same recipe and enjoy that together, which was a really fun, unique experience. And I think people could try doing the same thing remotely if they're unable to get together. The other thing I was going to mention is on that coronavirus.ohio.gov page, there's this holiday guide. And I learned of about 10 different holidays that occur between now and New Year's that I had no idea existed. So I would like to challenge somebody to go celebrate every single one of those remotely, because they have a lot of different ideas about how you can do that in a lot of different ways. So it was kind of fun. They did a good job of coming up with some unique ideas. As far as the curfew, honestly, Governor DeWine froze in the middle. He said, there's going to be a curfew, and he froze. And I've been trying to find all the details since then. I think it's from 10 p.m. to 5 a.m. But did Jackie or Dr. Bricking, did you guys capture more of those details than I did?
Yeah. Well, I can start. I captured a few. If you have to go to the store for an emergency, if you had to go to work, it's not included in that. What they're trying to do is to get people back home safely in their bubble. So they said it will be written guidelines to come out. It wasn't us, Mayor, it was him, because everybody was texting me, are you hearing it? Are you hearing them? So it was his bandwidth this time, not ours. So we will get all the details. But again, it is basically just trying to get people so that they don't gather. You're trying to just cut down some of the activity. And he said that he was really trying to please everybody, right? We know people are working and they have to be out. We know people are wanting to be in restaurants and do certain things. So he's just trying to encourage us to have safer behaviors. So we will get that out. We will put it on our website. It is going to be on coronavirus.com website, Ohio. And also the newspaper usually comes up with a really good recap. And so it should be out now as we speak.
I have just tweeted some things. So yes, it is a curfew that Dr. Bricking, I don't know if you have this information in front of you. You want to cover this?
I do not have it in front of me.
Starts Thursday, which is the 19th. Will run from 10 p.m. to 5 a.m. for 21 days. They believe that this will help reduce the COVID-19 spread. Said he's also asking each Ohioan every day to do at least one thing that reduces your contact with others.
Yes.
So if we can cut down contacts by 20 to 25%, this will make a difference. Paired with mask wearing, this will go a long way from stopping our hospitals from being overrun. So right now, Dr. Bricking, is there any reduction in elective surgeries at Atrium Medical Center? Are you anticipating that that might be the case if these numbers are still going the way they are going, or hopefully with this curfew slowing down the spread, can we stay at norm, I want to say?
I think it's going to be a challenge as the number of patients increase in the hospital to stay at full operations. Right now, what we're seeing across the state, more up in the Cleveland area, is they are starting to cut back on some of the surgeries. You know, the difference now compared to back in March and April is we have enough PPE. We feel we have enough equipment. We have the monitors, we have the ventilators. It really comes down to staff and people. And so we are certainly, similar to other hospitals in the area, looking at those resources, specifically the elective procedures that may require an overnight stay. And it's possible if they require an overnight stay, they're taking up a bed that potentially a sick patient could be in. And we may have to have that decision, make that decision where we have to cut back on those things. We're doing everything possible to stay full bore, open everything, but it is getting increasingly more challenging. You know, and the elective piece is a challenge as well, because even if you're at home and you've got the gallstone or you've got the knee pain or you've got the hip pain, to you this may not seem elective because you're suffering. And unfortunately, those are the things that we may have to postpone. We'll still do it, but we may have to postpone just so that way we have the resources at the hospital to take care of our patients. So again, as we socially distance, as we mask wear, as we're more in tune to our environment, what we're doing is we're freeing up the ability for the hospitals to take care of the patients that have the elective procedures as well as the sick patients.
Another personal question for me as these holidays come up. If you are mask wearing, is hugging allowed? Dr. Bricking?
You know, masks are still not 100%. And so I wish I could tell you with 100% certainty that if you both are masked and everybody just wash their hands, that you're 100% safe. I think this goes back to a lot of what we've been discussing is you've got your own personal bubble, the people that you live with, the people that you're with every day, and those people you can certainly be around because that's who you're around, but you have to be cognizant of it. You know, the human touch is critically important for our well-being. We talked a little bit about mental health resources. I'm not going to tell you not to hug because that human touch is important, but I think that it is important to, again, think about where has this person been? Have they been around anybody ill? Are they exhibiting any symptoms? Are you guys being honest with each other? Making sure that you have good hand hygiene and masking. And then you have to make the decision from there. Right. Jackie, I don't know if you have any other health department recommendations.
You exactly said it right. And another thing, Shelby, we have to look at all of our risk, right? All of our risk. And like Dr. Bricky was saying, if we've been around sick people, or if we've been around people that may be subject to being positive, and if we've been at large events, and if all of those are high risk activities. So I usually would not behave in a hug if I think I have been involved in high risk activity. I have 4 grandbabies and I love to be around them, but I'm not around them a lot. They're back in school and their mom is 33 and healthy and thinking she's kind of safe, but I don't think she is because I see her sometimes on Facebook. So I don't entertain with them. But if I were to let them come over, I keep a mask on. I usually try not to be around them because they're all ages, 12 to 3. And I watch that activity really closely. And when they leave and I clean real well, I don't have another high risk activity other than work in my bubble for another 14 days. I try to pace myself so I don't have to go back and say, what wedding was I participating in? What funeral did I go to? What birthday party? What dinner did I go to? All of those are high risk activities that if you became positive, we would have to contact trace all those people that you were with. So I tell people all the time, watch your risk. And if you really want to be around people that may be higher risk, that may be ill or older, we should make sure that, and Shelby, you and I have talked about this before, have really a risk-free couple of weeks before you're around those people so that you know that you're going to be safer, right? Because you haven't had a whole lot of high risk activity. My favorite thing to do is eat and drink. And those are 2 of the highest risk activities because you can't have a mask on. And normally I like to talk to people. I don't like to eat and drink alone. And so, yeah, so we try to watch those kind of things and just pace yourself when you have that, those kind of things in your realm.
So, Dr. Bricky, I want to make sure that everybody's aware there's been some changes, some consistencies, but some advancements in our knowledge of COVID-19 and what is the best way to keep safe. So, can you touch on close contact, what that actually means, what the timing is with or without the mask, the 6 feet thing, like what exactly should people be consistent with right now as the information has been advancing?
Mm-hmm.
That's a great question, and I would say that it's kind of been a little bit of a moving target over the last 6 to 8 months. And I think as we learn more and more about COVID-19, I think we're going to be much more secure in the recommendations. What we know now is certainly you should try to keep a distance of at least 6 feet from another individual. You should have a mask on, and there are certainly some concerns that if you're less than 6 feet for more than 15 minutes with or without a mask, there is a risk of spreading the virus. So the safest practice, again, is going to be to make sure that you are in a ventilated area, highly ventilated area, potentially outside, or if you're inside and you can have the window open, that's good because that helps move the air around. Try to keep your distance of at least 6 feet as much as possible, and certainly be wearing your mask.
Very good.
Okay. Mayor, what are you seeing from our residents out in the community? How are people responding to this, and how can we help them through this?
I think the hardest hit seems to be our business owners in general. They're starting to get frustrated. I know I did hear something from Governor DeWine, though, before he froze up on me. He specifically said, I'm not talking about closing businesses. So for what that's worth, I thought maybe it was something our business owners could feel good about, that there won't, from what I hear, there's not going to be mandates about business closures. And the other thing is, Jackie, I think you had mentioned about contact tracing recently, and
Yes.
how we're actually finding that the majority of cases are getting transmitted, not necessarily in businesses where people are masking up, but it's more those social areas, which is to me a good sign for the ability to continue our economic progress if we can get a handle on the social parts of it.
Correct. And you're absolutely correct. And personal responsibility is what we're hitting on now, because let's take, for instance, a football game. The football game itself is a very safe activity, right? But if you're conditioning with your players before and you know what that looks like, you're really close and you're spotting each other. If you're going out after the game to celebrate and you're eating or whatever, or spending the night, sleepovers for some of the high schoolers. So it's not the actual game, it's the pre-game and the post-game. And that's the same thing it is with funerals, weddings, and all the rest. So often it's not the actual activity, but the actual activity usually lends to risky activity. Can we go downtown and celebrate and let off balloons? We'll all have masks on and we'll keep our distance. Yes. But once we get in that joyous occasional moment and we're letting off our balloons, we start laughing, talking, hugging, and we start letting our guards down. And that happens often when you're looking at funerals, when people are sad and they're crying. What do? We want to hug them and comfort them. And so often it's not the actual act. Business says it's not it, but once you get out of your house, you are more likely to run into someone that you have not seen in a long time, want to stay, talk longer, get closer. And that's when we let our guard down. So we just have to be vigilant. And so we can do everything. Our personal responsibility is, how do we do everything that we really think is important to do safely? I tell you right now, I try not to go in restaurants because I love to talk. I already told you that. But I love to talk. And then I run into people I haven't seen, because you guys, I haven't seen anyone in forever. And then I talk. And then I talk and I talk more. And then the mask may come down, it's closer. And then you feel like, why bother? That's that natural human emotion. And that's what we normally would do because that's what we're used to doing. And so that's why it's easier, like kids, it's easier not to have candy, because to tell them, nope, they can only have one piece is kind of hard.
So I know there's a lot of people who have taken up some new hobbies since we've all been staying at home a little more. Anybody have a particular new hobby that they have started? My puzzle making has increased dramatically. So, Mayor, do you have a new hobby or an increased hobby?
Well, what do you think, Via? Here, how about Via says she's really enjoying all of these virtual meetings because she can participate in all of them.
She's got a lot more kisses going on there. Those are okay, right?
Yeah.
Dr. Bricking, you have a new one?
What we've been doing a lot of for the last 6 months is family game night. One of those things, it's very difficult I have 4 children, 4 teenagers, and they're always involved in extracurricular activities, or they want to be out with their friends. And we've obviously clamped down on some of those things. And that's afforded us a lot more family time to play games with each other. The other thing that we've been able to do with friends, other adult friends, is actually online cards. And so we'll play a virtual game of euchre or other games. So those are things that we've done a little bit differently in this new world.
That's great. Jackie?
You don't want to know mine. I like to eat and drink. So now I usually cook my food, and then I've been kind of practicing being a bartender and trying new drinks. So
there we go.
It doesn't change a whole lot, except I'm a lot safer, right? I'm not driving. I'm not a lot safer. Gained not really a few pounds. Actually, I've lost because I'm not eating out of restaurants. So my cooking is actually healthier. So that's better.
Okay. Anybody have any last minute advice for our residents of Middletown that they would like to touch on before we wrap up?
I would just say, we really need the community's help to flatten the curve. We've done this before, and I know we can do it again. Our goal here is to keep the community safe and make sure that we have safe nurses and physicians that can take care of our patients. So do whatever you can to follow our recommendations and the recommendations of certainly the health department. Wear a mask, wash your hands, and limit the number of people that you're around. Just want to thank the community for continually being supportive of Atrium and Premier Health. We do have a lot of resources on our website as well. We also have partnered with CompuNet with lab testing. So if you have a physician order, there are 11 testing sites 2 here in Middletown and 1 down in Westchester that you can access. We've also expanded our ability to do virtual visits, and you can also find that information on our website. So thank you.
And I was wondering, Dr. Bricky, I'm sorry, Shelby, but can you talk about your plasma? Do you have information? Is Atrium and Premier advertising how to donate plasma?
Yes, we have that information on our website as well. We have seen some clinical benefit now in patients that have recovered from COVID, where they can actually donate their plasma and then we can give it to a patient with the same blood type. We've also been involved in a couple of clinical trials with some of the different antiviral cocktails and medicine cocktails that currently treat our patients in the hospital as well. So all that information is on the website, and we feel we're pretty cutting edge when it comes to a lot of those things. So thank you.
And Shelby, if I go next, and I can let the mayor just take us home, but I just wanted to say to the community, thank you, thank you, thank you. As with everyone else, we need everybody, and you have been great. I talk to a lot of you most of the time, and I know how frustrated and how fearful this is and how long and drawn out this is. But this is our first pandemic that I am aware of, and it is definitely different. And we're going to be able to look back on this time, and I believe we're going to come out stronger and better on the other side. And for all of you that know me and or have heard about me, or those that don't, I just love everybody. And even if I don't like you, I still love you. And I want my community to be the safest, healthiest, educated, the most best MIDI community, purple community, blue skies over Middletown community that we can be, because we are all in this together. So I thank you. I am here for you. Call me at any point if you need anything, but we just need to mask up, back up, and wash up. I appreciate you all.
Well, Jackie hit on pretty much what I was going to say about challenges that we go through in life make us stronger in the end. And I would just encourage people that that mental piece is definitely the toughest right now. And so if you find yourself with negative thoughts about anything, it doesn't even have to be related to COVID, but somehow COVID has made its way into it, because let's be honest, it's put us all on edge. I challenge you to come up with 3 positives to combat that negative, and turn your own mind into a positive weapon for good, and to help yourself do ultimately even greater things than if we hadn't gone through this to begin with.
Well, thank you all for your time. And if anybody has any questions, they can always call our health department or visit our website, which is cityofmiddletown.org. And we will see you next time. Thank you.
Thanks.
Thank you. Take care.